I wanted to take the opportunity today to talk with each of you as College of Nursing students here at the University of Saskatchewan to share with you some of the discussion that's occurring in relation to tuition rates for 2016-17. So just to review, and I know you're aware of this and that it's on the university website, but the principles that guide tuition rates there are three. The first is comparability. How are we as the University of Saskatchewan able to compare with the other U15 universities across Canada? We aspire to stay at the median or slightly below, and certainly in relation to Alberta and Manitoba, we are successful in doing that. Secondly, we want to ensure that nursing education, in our case, is affordable and accessible. As you all know, we're at 6 sites across the province, so we have tried really hard to ensure that Learn Where You Live is an option and a choice for our students. And lastly, quality, that we do have the resources to provide a quality education for students within the College of Nursing. So with that in mind, the discussions occur from each college in relation to what the tuition rates should be. Now, I want to go back to the website again, where you could go in now and see what the cost is per year at the four-year program. It's averaged out across all 4 years, not just the pre-professional by itself and then the 3 years, but all 4 years. And the rate right now that you would see on the website for our 4-year program for 15-16, it says that it was $6,232.59. Well, each of you know that that's not what you paid. In actuality, you paid $6,913 for the 4 years. And the reason for that difference is when those calculations were done, it really looked at averaging out the courses as though they were all equal. And because we have multiple colleges that provide the courses for our program, it's not one tuition rate. And in addition, whereas some programs have 120 credits, within nursing with our spring term, we have 132 credits. So when we looked at the cost of the real cost for our students, it was around $700 higher than what it was projected or looked like on the website. So with that in mind, we then had to consider what would we do for the upcoming year. And there are different proposals that will go in per college. The university was projecting that we would probably need around a 2 to 2.5% increase. We have decided not to do that as the College of Nursing so that we would stay below the median. And so our projection would be 1.5%, which would mean a difference of $139 per year over the 4 years on average. That's what it would cost. So the proposal that we will put in will reflect that. Again, we know that previously for 15-16, or for those of you who came in this year, the rate did go up 2.5% a year ago, and prior to that went up 5.5%. So we actually think that we are on par with where we need to be to deliver our particular program. It is challenging too at each of the sites. There's a difference in what your student fees are because, of course, you have access to different resources. So each of the associate deans, Dr. Mary Ellen Andrews in Prince Albert and North, Dr. Hope Linsky in Saskatoon, and Dr. Lynn Jensen in Regina, will each be setting up meetings with the Nursing Society executive. And based on that meeting, we'll determine how to have a conversation that would be site-specific with students, or if the executive would choose to do that. So my message to you today is that we realize that the cost that's on the website is not the true cost for you. And so when it's used as the comparator with the other U15 universities, it actually is lower than reality. But when we adjust for the weighted cost of all of our courses and how they're taught, we still are below. And even with a 1.5% increase, would remain below the median. So with that in mind, I would encourage you to meet with the associate deans, certainly as the executive, to ask questions, and they will do their best to respond. Thank you for the opportunity to speak with you today.